that we deliver healthcare in this country is usually through insurance. So folks without insurance have a barrier that is very difficult for them to cross over without assistance.
Our patients are so happy to be here because they have not been receiving care. I've been a nurse for 58 years, and I have worked in numerous venues. This is the happiest place, honestly. Everybody is happy and lovely and kind, and you know, it's not like going to a stiff office.
We have a fabulous medical staff with a medical director, but it's the nurses that greet the patients, it's the nurses that do the discharge.
The people who are here are amazing, and it's just as though they dropped out of the sky. This amazing group of doctors and nurses.
The mission of Rotocare is to deliver excellent medical care to folks who are chronically ill but have no access to the clinics, to medical clinics.
There's one young man that I can think of who is so ill and close to death. He's got a job, he's lost 150 pounds, his blood sugar is normal, his hemoglobin A1C dropped 4 points, which is unheard of. That's the kind of thing that there is a future.
We had one family who we kept until he was eligible for Medicare. He came back, he said he had never received such good medical care in his entire life. He gave us a check for $500. And this is a family who scrimped to take their grandchildren to a movie maybe every other month.
I would love to see it end, because my hope and my prayer for health care, so we all are afforded health care, that, you know, that there's a possibility that maybe this wouldn't have to be anymore.
I never asked to be the voice of the uninsured, but who is? Who's out there talking on behalf of the uninsured? And when our patients ask me, why do you do this? I say, because we're all in it together. We are. We're all in it together.
Well, good morning. Is this on?
No.
It's okay. Everybody can hear me, is that it?
All right. Well, thanks for having me. It's always a pleasure to talk about Rotocare to any group, but I always feel welcome at a Rotary meeting for many reasons. First of all, I know so many people. There's Sandy back there, and Sandy and I know each other because we do repack at EFN every month. And there's the Exchange Club winner. Dan Powell is the Exchange Club winner for Volunteer of the Year because of his work with Gateway Medical Alliance. I'm sure you all know about that, but he's done fabulous work. And others of you I've seen in various venues. But we're going to talk about Rotocare, which is an interesting story. I think it's an interesting story. So let's get started here. For 18 years, I made tombstones. I was a third-generation monument maker. My dad started Tacoma Monumental Works, and I started working when I was 11, left as soon as I could to become a nurse. I was a nurse for 10 years, and I was won the International Technical Vocational Award for Rotary International in 1983 because of my work as a nurse practitioner. But when my dad got sick, I came back to Tacoma to take over the family business. And so I had a business here on South Tacoma Way for 18 years. And this is my favorite epitaph. We really did carve this in stone. The guy really was sick. He died. So sold the business, and in 2006 I went back and got my nursing license renewed, and then got a master's in nursing from University of Washington in Tacoma. After that, I was at a fish food bank, and I'm sure you're familiar with fish food banks. It's probably a project of yours. Fabulous, fabulous organization. I was painting fish food bank, and the director came up and handed me an article on a food bank in Milwaukee that had started because folks could not get to see a doctor, but they can move heaven and earth to get food. So why not put a clinic in a food bank? And when they put the clinic in the food bank, they had a very low rate of no-show. People actually did go see the doctor if it was at the food bank. So all the other barriers of transportation and all those other things go away if you combine your services. So she says, why can't we have a clinic in a food bank in Tacoma for folks with chronic disease? And I said, I don't know why we can't do it. The model in Milwaukee had lots of partners, the School of Medicine, School of Pharmacy, School of Nursing, lots of folks on board. Tacoma is not Milwaukee. We have great schools of nursing, but we don't have the other major schools. But maybe there was a way to get around it. So that was about 2008. She approached me with this idea. The first thing you're going to do, if you're going to start a venture, the first thing you're going to do is get some data. There might be some great ideas out there, but why put any effort into it if you don't have data that substantiates it? So if you remember back in 2009, how ugly it was. This is a chart of the rapid hemorrhaging of job loss here in Pierce County. It was awful. 2009 was just awful. And the scary thing about job loss in our society is when you lose your job, you lose your insurance. So there was a sense that there might be a lot of folks out there who might need medical attention but couldn't go. So doing some general surveying, it turns out that, so what if people, they've lost their job and they've lost their insurance, but so what? Is that such a big deal that they don't have insurance? Well, all of the national data was suggesting that for folks who don't have insurance are actually sicker than people that do. And this data has been repeated over and over and over again. For instance, in the general population, the incidence of diabetes is about 8%. In the population of folks with no insurance, it's about 14%. And the consequences of that is, if you don't have insurance, you don't take care of your chronic condition. So that's the part of this. You know you've got a disease, but you will forego seeing a doctor or getting medicines because you have no insurance. So now we're looking at consequences of untreated disease. Okay, so that was national data. I went back to University of Washington Tacoma School of Nursing and I asked for help with the student nurses to go to the food banks. So we actually ended up surveying 550 people. This was just the first survey. Of the 550 people, the data didn't change much. Almost half of the folks at food banks have no insurance. So half of the people that visit food banks have no insurance whatsoever. The other really ugly number is within the past prior year, 41% had gone to the emergency room. Now, we'll talk about the effect of emergency room use on your premium later. Okay, so I had gotten a lot of data that suggested there were a lot of sick folks out here in Pierce County, a lot of sick folks without insurance. So you don't do anything successfully by yourself. And I rounded up some critical partners that would make the idea of a clinic for folks with no insurance but have chronic disease. One of the first partners was the Washington State Free Clinic Association, which belongs to the National Association of Free Clinics. I don't know, do you remember back in April of 2011 when the Tacoma Dome was turned into the country's largest doctor's office? It was called the Care Clinic. The National Association came out here. That's because I made the phone call to Olympia, who made the phone call to National. I said, the people in Pierce County, Tacoma Pierce County, play together so well. We can host one of these big mega clinics. So on April 11th or April 20th, 2011, we have 1,400 uninsured people come to the Tacoma Dome in just one day. There are 3 other large free clinics here in Tacoma, Pierce County. The biggest one is Neighborhood Clinic. They're open Mondays and Thursdays. There's Trinity, which is at Trinity Presbyterian on 6th and Sprague. And then Project Access is a child of the Medical Society. So if you are a doctor, you can agree to see patients for free in your clinic. The patients are issued what looks like an insurance card, but it is a Pierce County Medical Society card. So when you take one of those patients, they hand you this card, and you are seeing that patient as if they were insured. So those are the other 3 big partners. Now, I'm a volunteer. My life is going to be too short to put Rotocare out there for anybody that thought they might be sick and have chronic disease. So most of my patients come from these other free clinics. The nature of free clinics is that it's urgent care. So a free clinic is set up to do pink eye, broken arm, arthritis, any of those episodic problems. But if you have the same patient coming back again and again and again because they've got diabetes or hypertension, you can't see anybody new. So free clinics in this town and all over the country are overwhelmed by chronic disease patients. So these free clinics, they were ecstatic that we were going to set up a 3rd clinic just for referral from them for folks with chronic disease. Well, I'm an old manager, and if you're a manager, you know you got to have staff, stuff, and space, right? So the staff was going to be volunteers, just like me. I belong to Pierce County Medical Reserve Corps, which was started after 9/11. What happened in New York City when 9/11 happened was all of these folks showed up to New York City saying, I'm a doctor, I'm a nurse, I want to volunteer, please, 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 I want to do something. But the local authorities couldn't use them because the local authorities didn't know who they were. Anybody could say they're a doctor, but they weren't vetted. So the government under FEMA set up the Medical Reserve Corps, a little bit like the Peace Corps, but what we are licensed healthcare volunteers or unlicensed if you want help on logistics, because it takes some muscle power to move stuff around. So since 2006, we've had Pierce County Medical Reserve Corps. It's housed in the health department, and we're all just volunteers willing to volunteer if there's a public health emergency. When H1N1 hit, we did just shy of 10,000 immunizations. And after it was over, I felt like I had given every one of them. So I put out the call to Medical Reserve Corps, and I got all of these great doctors and nurses to volunteer. If you're going to have an agency, you also have to have infrastructure. I didn't feel like setting up my own 501c3. So I heard about Rotocare Free Clinics of Puget Sound. Rotocare Free Clinic started in Oakland, California by the Rotary Club of Oakland, California. Rotary Club of Oakland saw the need for more free clinics, urgent care, but free clinics. That one was sponsored entirely by that club. The other Bay Area Rotary clubs thought it was a great idea, so they added more free clinics. So each Rotary club sponsored a free clinic in their community. Then one of the guys from Oakland that started that moved up and became one of the managers of Overlake Hospital and started Rotocare Free Clinic of Bellevue, which is sponsored by the Bellevue Rotary Club. Then the Rotary Club of Renton started a free clinic in Renton. Lake City Rotary started Lake City Free Clinic. Rotary 8 started Rotocare, or is our sponsor for Rotocare of Tacoma. They've got the 501c3, they've got the insurance policies, they've got policies and procedures. It was great, and they were looking to expand to Pierce County. The thing about having a free clinic for urgent care is you need a lot of stuff. You need a lot of bandages and wraps and thermometers and stuff. You need stuff if you're going to be a free clinic. If you're treating chronic disease, though, you don't need stuff. You need a blood pressure cuff and a stethoscope to take blood pressures. But if you have a fever, we're sorry. But we don't want to know about it because we don't treat urgent care problems. That's what the urgent care free clinics do. So if somebody complains of anything other than the chronic diseases, we send them back to the urgent care free clinics because we just treat the chronic diseases. But the one thing we need to know if medicines are working, and we need to know that your kidneys and liver aren't being affected by disease or by the medicine. So right from the get-go, St. Joe's lab stepped up and said, we'll do all of your lab work. Because if anybody that has diabetes and hypertension knows every 6 months you have to go in for your basic metabolic and make sure your kidneys are working okay and all that. And if you have diabetes, you have to make sure that your A1C levels are okay. St. Joe's stepped up and said that they would do our lab support. So every Wednesday night after clinic, I drive down to St. Joe's lab with my little bag of blood, and I give it to the lab folks there at St. Joe's, and I get my results on Friday. It's wonderful. After the first year and a half or so, after banging on Multicare's door persistently, I'm one that tends not to give up, they agreed to give me insulin. Because our model is that you come to our clinic, we'll give you the medical care and the lab support, but you have to be able to afford your drugs. All of those drugs are managed by medicines, right? Hyperlipidemia, or statin, anti-diabetics or for high blood sugar. So, and all those drugs are $4 drugs now. You go to Walmart, Target, they're all $4 drugs. So everybody has to be able to buy their own $4 drugs from the prescriptions we write. The exception is insulin. Who can afford insulin? Nobody. So Multicare now gives us insulin. So we're glad for that. Every month I drive down with my big ice box and fill it up with insulin. So the model was, we're not going to treat all chronic diseases. We're going to treat the big ones. The biggest diseases that have the biggest impact on population, which is diabetes, hypertension, and hyperlipidemia. Those are huge diseases for a variety of reasons. But those diseases, if left untreated, have huge impact. Blindness, stroke, you lose your feet, you lose your kidneys, you die. So those are the only 3 things we see. If you have something else, I try to refer you somewhere else. But these 3, we do a real good job of managing. So it happened. In fact, we just celebrated our 4th anniversary. When we first started, we started at the Fish Food Bank, the largest food bank in Pierce County, which is Southeast Fish. It's at the Christ the King Lutheran Church on South 85th and Portland Avenue. So we started there. We were there for about 6 months. We were in the Sunday school wing, itty-bitty chairs, itty-bitty tables, and kind of cute, the doctors and the patients sitting. But we outgrew the Sunday school wing real fast. And Pacific Lutheran University stepped up and said, you can use our janitor's lunchroom every Wednesday night after the janitors go home. So at 4 o'clock every Wednesday, we're pushing boxes around and pipe and drape for these little exam rooms. We don't need tables, right? I mean, it's a story. How was your month? How was it? So every exam room has two chairs and a table. And PLU doesn't charge us any rent. It's a great partnership. We get 2 or 3 or 4 doctors or nurse practitioners. We get 2 or 3 or 4 RNs and a couple of support folks, and all of us are volunteers. So, what is the impact of not having insurance but having folks who are sick? This is from the Department of Health website. And when I first was giving this talk, in fact, I was here about 5 years ago before I actually opened the doors of Rotocare. I was doing a lot of this data. Now this data is now updated. It was the hospitals usually are at the point of entry, right? If somebody's really sick, they can't afford to have a regular doctor's office. They wait until they're so sick, they go to the emergency room. The hospitals were calling it uncompensated care. They now call it charity care. But trust me, it is not uncompensated. When in 2009, when I opened Rotocare, the projected uncompensated care was just shy of $600,000. It was projected to be about $620,000 the next year. This is for the whole state. The reality was in 2009, uncompensated care was 826,000, and 2010 was over $1 billion of uncompensated care. What happens with $1 billion of uncompensated care in your hospitals is that they know the hospitals cannot collect it from the patient, and they cannot turn the patient away. That's a federal law, cannot turn the patient away. They charge the third-party payers more. So if you've wondered why your premiums have gone up substantially, one of the major reasons is the increasing volume of folks with no insurance. So they pass the cost on to those who can pay, which is the third-party payers, private insurance companies, and the Medicare, Medicaid. So, from the national point of view, this is very current, 2013. Of adults, our population at Rotocare is any adult under the age of 65, because at 65 you get Medicare. So that's the green bar, the green bar. Private coverage in that age group, so that'd be 18 to 64, is just shy of 64%. Public coverage is the 17% there, the green bar. And uninsured at the time of the interview is almost 21%. 21% of folks in this country under the age of 64 and over the age of 18 have no insurance. Now remember, that's 20%. That's a lot of people with no insurance. And we know that those folks are sicker, and those folks wait until the consequences have set in. They wait until kidney failure happens before they go to the emergency room. So it's a gigantic impact to not treat people because they feel they don't have access to a doctor. So that's it. That's the kind of the story of Rotocare in a nutshell. I'll entertain any questions. Yes, ma'am.
The Affordable Care Act.
Yes.
How will that affect your
I hope to close down Rotocare. And it turns out, I just went to the state conference, we are the only clinic that wants to close. I really want to close because why would I have doctors and nurses volunteer to take care of a patient for free for a year if that patient had access to health care? So, and we're just free. I mean, I can't take care of Parkinson's or hepatitis C or pink eye. I mean, they need to have a medical home. They actually need to have a doctor's office. So the way that I see our safety net, are you familiar with Neighborhood Clinic and Trinity Free Clinic? Have you sponsored them at all? Because that is our first line of defense in the safety network in this county, Neighborhood Free Clinic. So what I would like is for our model, which is we treat folks for a year that have no insurance, or until they get a job, or until they get insurance, or until something happens. I would like to support the existing urgent care free clinics and keep folks for a shorter bridge. So it might be, because let's say they sign up, somebody can now sign up between yesterday and January 1 for coverage. That means January 1, they will have some kind of coverage. They can go to a doctor. Community health care. Are you familiar with community health care clinics? Okay, great. They are gearing up. They are expecting 15,000 more patients in January. So David Flange and that group, they are ready for folks to sign up with the Affordability Care Act. So why would I say, no, I really want to volunteer, I want to help people? No, to help people, you help them get coverage. So what I want to do is bolster the safety network and have Neighborhood Clinic or some other free clinic carry folks for that short term now until there's a spot for them at community health care, CMAR, Project Access, or another kind of a doctor system here in the multi-care Franciscan systems.